Posterior pelvic tilt and kyphosis is one of the most commonly reported complaints when it comes to seating and results in the user sliding down or out of their wheelchair. When the pelvis rotates posteriorly or backwards, the ischial tuberosities or ITs slide forward along the seat, which in turn brings the coccyx and sacral region into contact with the seat surface. Sitting in this position increases the user's risk of skin breakdown around their bony prominences due to direct pressure and shearing within the tissues. As the pelvis and the spine are connected, the spine will also change shape. The backward rotation of the pelvis causes the spine to curve and form a C shape, known as kyphosis. Kyphosis of the spine also affects the position of the neck and head, as it forces the user's chin closer to their chest, which in turn reduces their visual field. Several other physiological body functions are also affected, including swallowing, digestion, breathing, speech, and even bowel and bladder function. This is due to the trunk collapsing and compressing the body's internal organs. Posterior pelvic tilt and kyphosis can be caused from an incorrect setup of an existing seating system, or it can be caused through clinical issues relating to the user, for example, muscle weakness. In some cases, it can be a combination of both. Problems relating to the seating system may include the seat depth being too short or too long, the foot supports being too high or too low, the seat to floor height being too high or too low for effective foot propulsion, the rear wheels being positioned too far back, making propulsion difficult, or it could be due to lack of support from the backrest at the posterior superior iliac spines, PSIS. Clinical issues or issues related to the user may include problems with tone. High tone may result in the user extending out of the seating system, whilst low tone may cause them to slouch or slump. Alternatively, the user may lack 90-degree flexion at their hips, or just one of their hip joints. Not being able to flex or close the angle hips to 90 degrees will cause the user to slide down the seat surface. As mentioned in the mat evaluation video, opening the backrest angle can be an effective solution for this problem. Another reason is because the user may have weak abdominal muscles, which causes their trunk to collapse, or weak back extensor muscles, which prevents them from maintaining an upright sitting posture. Tightness of the hamstrings may also be a problem. The hamstring muscles, of which there are 3, attach to the bottom of the pelvis and run down the back of the thigh, through the knee, and attach just below the knee joint. Extending the knee stretches the hamstring muscles to their full length. However, not everyone's hamstrings can be fully stretched. Maintaining an upright sitting posture in a wheelchair can then become challenging. The shortened hamstring muscles make sitting with the knee extended difficult, as when in extension, the hamstrings pull on the bottom of the pelvis, encouraging it to rotate backwards, which causes the person to slide. Some people have very tight hamstring muscles and are unable to use standard footrest hangers of between 70 degrees or 80 degrees, as they overstretch the hamstrings and cause the user to slide. In these instances, a 90-degree hanger angle can be more effective. However, attention needs to be paid to the wheelchair configuration to avoid conflicts between the foot plates and the front casters. If this is an issue, you could consider the use of angle and depth adjustable foot plates. To correct a flexible posterior pelvic tilt and kyphosis, always start with a contoured seat cushion. This is essential to stabilize the pelvis, extend the trunk, and achieve an upright seated posture. However, a contoured cushion alone cannot maintain an upright posture. This is only achieved when combining a cushion and a backrest which supports the rear of the pelvis at the PSIS. When fitting a replacement back support to the wheelchair, such as the Invacare Matrix range, fit the bottom of the back support so it is level with the user's PSIS. The PSIS are bony landmarks on the pelvis that can be used as control points to stop posterior rotation. When determining the height of the back support, it should be tall enough so it sits just above the apex of the kyphosis, the point at which the back is most curved. This, however, is only applicable to a flexible kyphosis, but will have no effect on a fixed kyphosis. If, after combining the seat cushion and back support, the user still tends to slide, the use of a secondary support, such as a pelvic belt, is recommended to control any further unwanted movement of the pelvis. For users who present with a posteriorly tilted pelvis, fitting a pelvic belt at the standard 45-degree angle across the hips will be ineffective. In this position, the belt creates forces across the front of the pelvis, where the anterior superior iliac spines, ASIS, are located, and will only cause the pelvis to tilt further backwards. Ideally, a pelvic belt should be fitted between 60 and 90 degrees. The best way to accommodate a fixed posterior pelvic tilt and kyphosis is to use a seating system that combines tilt and recline, otherwise known as tilt in space. Tilting uses gravity to improve the user's neck and head position, which increases their visual field. The use of gravity will also open up or expand the trunk and abdominal region, which will improve swallowing, breathing, communication and digestion, as well as bowel and bladder function. With any tilt-in-space system, a suitable headrest that meets the user's individual postural needs should always be used. A secondary support can also be fitted as and when required. It will not correct the user's posture, but it will help to maintain an optimum seated position. For more information on how to correct or accommodate for other common postural presentations, please see our other videos.